Hi, my name is Lily, and I'm going to be your student nurse today. We're going to do a head-to-toe assessment. Is that okay with you?
Mm-hmm.
Okay, so I'm going to first close the door for privacy or curtain, and I'm going to start off by washing my hands for hygiene, and then I'm going to ask you a few questions before we get started. And can you state your name and date of birth?
Karina Pinnell, May 2nd, 2000.
Okay, and I'm going to check to make sure that matches your wristband. And then, do you know what year it is?
2022.
Do you know who the president is?
Yes, Biden.
And do you know where you're at?
Yes, my room.
Okay. So the patient is alert and oriented ×3, and her posture is erect, and her gait was steady when she walked in. She's calm. Her affect is calm and cooperative. Her speech is clear, and I'm gonna assess your pain now. So on a scale of 0 being nothing and 10 being the worst pain you've ever felt in your life, what is your pain level right now?
0.
And her pain is 0, and before I came in, I checked her vitals, and they were all within normal range. So we are going to get started on her head. So looking at her face is symmetrical, her nose is midline in her face, and her hair is evenly distributed, and I don't see any lesions or infestations. Her skin is warm and dry to the touch, and her color is good for, or perfect for her ethnicity. And so I'm going to get started with her eyes. So if you will just look straight ahead. Okay. Look this way. Okay, and then follow the pen light to your nose. Okay, so her perla would be noted because her pupils are equal bilaterally, and she had light accommodation. And so now, if you will go like this to your eyes, like pull your skin down. Right, her conjunctiva is pink and her sclera is white. Again, all good, and within, or all is normal with her eyes. And so now I'm going to fill your ears. I'm going to fill her ears. And any tenderness?
No.
Okay. And then I'm going to look in. And the other side. Alright, so there's no tenderness, no drainage or redness in the ears. And then I'm going to have you take your finger on your nose and blow out on the other side. And then do it to that side. Alright, so her nails are painted. And then there's no drainage coming from her nose. Her hearing is intact. You haven't had any trouble hearing me, have you? Okay. So her hearing is intact. And so now I'm going to have you say ah. Ah. Alright. So her uvula is midline, her tonsils are not inflamed, her detention is intact, and her mucous membranes are pink and moist like they should be, and her lips are pink like they should be. So everything is normal with the mouth. And so now I'm going to fill your sinuses. Any tenderness?
Mm-mm.
Okay, so her sinuses are not inflamed, they're not palpable, and there's no tenderness. And so now I'm going to move down to your neck. So I'm just going to move your hair out of the way. So I'm just going to fill your lymph nodes. Any tenderness?
No.
Alright, so her lymph nodes are not tender, not palpable, and I'm going to check her carotid. Alright, so her carotid pulse is +3 strong bilaterally, and I'm going to check your jaw. Will you open your mouth and close? Alright, so her JVD, there's no clicking or anything like that, so her jaw's intact. And then her jugular vein is not distended while she's in this position. And so I'm going to listen for a carotid bruit. So when I put this on your neck, I'm going to have you hold your breath.
Okay.
Take a deep breath for me. Alright, not take a deep breath. Hold your breath for me. Alright, so no bruise were heard on the carotid on either side. And so now okay, I'm gonna have you press against, like, try to turn your face this way. No, I'm trying to turn your face this way. Okay, I wasn't doing that like with a lot of pressure, so let's try that again. Okay, try to turn that way. And try to turn that way. Okay, and then go like this for me. And then go like this. And then roll your neck like this. Okay, so her strength and her range of motion is appropriate for her age. And it is intact, strong. Everything is normal with that. So again, if this is a real patient, I would have I would check her heart sounds and her bowel sounds, and I would check for up with her shirt off. But for privacy, we are not going to do that. So just looking at her neck, right here, and again, assuming that her shirt would be off, I would say no, or I'll check for lesions. So we're gonna say no lesions, no bruises, color perfect, or color appropriate for ethnicity, no turgors or edema or anything like that. And so I'm going to go ahead and check all 5 heart locations. We're gonna do aortic, pulmonic, Erb's point, tricuspid, and mitral. So I'm just gonna listen to your heart. Alright, there was audible sound in all 5, obviously because our heart is beating because she's sitting here, but S1 and S2, that's all there was. There was no murmurs or clicks, and so now I'm going to listen to your epical pulse for 60 seconds. What's the timer? Okay, I'm going to listen to your epical pulse for 60 seconds. Alright, so her apical pulse was 80, so that is within the normal range of 60 to 100. And so now while you're in this position, I'm going to go ahead and listen to lung sounds. So I'm going to have you kind of like face that way. And I'm going to listen to your posterior. And every time you feel me move this, I want you to take a deep breath, okay?
Okay.
Alright, and I'm going to have you turn to the front. And we're going to do the same thing. Every time you feel me move it, just take a deep breath. Alright, so her anterior and posterior lung sounds were both unlabored, even, and vestibular. There was no rubbing or wheezing or anything like that, so they were normal. And so now I'm going to have you lay back. And we are going to check for vowel sounds in all 4 quadrants, starting on the right upper, right lower, left upper, left lower.
Is this good? Is this good?
Alright, feel move your hands. Right. Oh, right lower. Okay, I think I said right upper, right lower, but I meant right lower, right upper, left lower, and all 4 quadrants were hyperactive. And so now I'm going to check for a vascular brewery in your aorta. So if you will just hold your breath when I do this. Alright, no breweries were heard in the aortic part of her vascular system. So now, and again, I would check for lesions, bruising, color, but for the sake of this, we're going to say there's no lesions, no bruising, no color. Her skin is warm, dry, and appropriate for her ethnicity. There's no edema. And after I just do those vowel sounds, I'm gonna put some pressure on them. Alright, was any of that tender? Alright, so there's no tenderness, and her abdomen is symmetrical, there's no distension, and while she's in this angle, I'm going to check her jugular vein again, and it is still not distended. And so now we're going to move on to the lower extremities, and I'm going to check her femoral pulse. So that's kind of awkward, but I'm just going to check your femoral pulse. Alright, so her femoral pulse is +3 strong, and we are going to move on. And so looking at her legs, they are warm, dry to the touch, there's no edema, no bruises, discoloration, lesions, can't remember if I already said that or not, anything like that in the lower extremities. And I'm going to check your popliteal pulse. Alright, so both her popliteal pulses are +3 strong bilaterally. And while we're down here, I'm going to take your slippers off for a second.
Okay.
And your socks. And I'm going to check the dorsalis pedis and the posterior tibial, both of those pulses. Alright, and both of those are +3 strong bilaterally, and I don't know if you can see, but she has no polish on, but again, if I was doing the capillary refill, I would press both toes and see the blood come back, and we'll say for this that it was, came back in under 3 seconds. And so I'm going to do the clonus reflex too while you're sitting like this. I'm just going to press back. Alright, so there's no jerking or anything like that. and that should check to make sure there's nothing wrong neurologically. And so, and her nail beds are clean, not bedded or anything like that. So I'm gonna have you sit back on the edge of the bed, and I'm going to check her tendon reflex, so you can have your feet dangle. And I'm gonna just, alright, and both of them, because they both had a reflex, so that's normal. And then I'm going to have you pull both of your sleeves up tight here. Okay, I have to go on the door. Hold on one second. So we are going to check your brachial and radial pulse. So if you'll put both arms out. Alright, and then turn. Alright, so her brachial and radial pulse are both +3 strong bilaterally. And again, she has nails on, but for a capillary refill, I would press the skin and see how long it takes the blood to refill, and we'll say for this it's under 3 seconds. And her nail beds look clean and they look good and normal. And we're gonna do some range of motion. So if you'll go like this, and then back down, and then like this, like this, okay, and then try to press down on my arm, but I'm gonna put my hands underneath you, try to move my hands down. Alright, and then up. Yep. Like this. Okay, and then grip my fingers and then pull. Alright, so her range of motion and her grip and strength is equal and appropriate for her age. And then I'm gonna have you stand up, and I'm gonna have you go like this, and then like your ankles, this, and then your hips like this. Alright, and then the other way, like this. Alright, you can have a seat. And so her range of motion is intact in her lower extremities. And I think that's it. So Olive, you look normal. Everything is good. Again, I can't think of anything else. So, all right. Well, thank you.